Welcome back. Are you or your children glued to your smartphones? Well, new research shows text neck is becoming a huge problem that could lead to permanent damage. We are always checking text messages on Facebook, emails, and this posture we adopt when we stare down at our phones is causing excessive wear and tear. That's why we have Dr. Raesz here from Advanced Chiropractic to explain the problem in further detail and what steps we need to take to fix it. Well, thank you for being here today.
Hey, thank you for having me, Marlena. It's always fun.
So we have some pictures to show you exactly what looking down at your phone can do to your neck.
So this is a picture of a neck curve, just like the person's facing this direction. Now the neck curve should actually curve this direction 43 degrees. But you can see this is a young lady that was at our clinic. We took a picture. She's 17 years old when we took this picture, and you can see her neck curve is already going backwards.
Wow.
Now this is a major problem because right up in this area here, this is the brain stem. And the brainstem is the conductor for all of our organs. And we want our organs to be functioning at 100%, right, Marlena?
Definitely.
Now, picture this. Picture all of your organs as an instrument. And every organ, your heart, your lungs, your stomach, every organ is an instrument and is playing randomly. There would be complete chaos in your body, correct?
Right.
Now, you have your conductor, you have the brainstem, and that area gets it to play together in beautiful harmony, like a symphony. However, if you have a reversal of the neck curve like this, it puts pressure on the brainstem. It starts to tether the brainstem in the spinal cord. And I'm going to go to this next picture here. This next picture is an MRI of the neck with a backwards curve. This is the spinal cord here. As it comes up, you can see how thin, pencil thin that brainstem gets there. And so whenever that happens, research shows that abnormal spinal curves can take 15 years off of our lives.
Wow.
Yeah, it's major. This also, if you have a reduction of or a loss of the neck curve, it can reduce our lung capacity by 30%. It can affect our gait. It can affect our balance. And once again, it can affect every single organ in your body. So whenever we're texting, or if you had a car accident or a fall, but today, I'm seeing more and more younger people who haven't had any injuries, any kind of car accidents or anything. We're presenting with these abnormal curves. And I think it's a lot to do with the phones. We're always down on our phones. We're texting. We're emailing. We're playing on Facebook, all these different things, and our necks are always down. And so this reversal of the neck curve starts to happen. And if you're not taking care of it, you're not getting it fixed or checked on a regular basis, then this is just presenting worse and worse problems in our bodies.
And what was surprising too, you said when you took that picture, she was 17 years old.
She was 17, and I don't think she had any history of injury or anything like that. So we're seeing more and more young people being affected by this problem.
Right. So we have some other pictures to show. Right.
So this is once again the X-ray of the reversal of the curve. And she went through a program. We actually we were able to help this young lady, and we were actually able to improve the curve and get it going back in the right direction. And so my suggestion is to have everybody get checked, because you may or may not present with symptoms with this kind of injury. But you may have symptoms. You may have headaches, you may have neck pain, you may have shoulder tension, you may have numbness, tingling, weakness going down your arms. You could even have organ problems. It could affect the brainstem, once again, affects all of our organs. And so I'm strongly recommending that people come in, get checked. If you do have abnormal curves, we'll start to work on them, we'll start to fix them over time. I do have a picture, I don't know if they're going to bring it up or not, but it's a picture of oh, there it is. So her curve was backwards 12 degrees. Now it's actually going in the right direction 15 degrees. We got a 27-degree improvement with her neck curve here. And so by doing that, it takes a lot of pressure off this brainstem, a lot of pressure off the spinal cord. And so her life is going to be dramatically changed because of that.
And has she said any suggestions to you or any improvements that she shared with you since going and getting chiropractic care? Yeah,
that's a great question. So she presented with headaches and neck pain, and all those symptoms have gone away. And so, the last time I talked to her, she went on since then to college and is playing college sports. And so that was her goal. And with the reversal of the neck curve, would she have been able to do that? Maybe, maybe not. But now she's able to. So she's able to accomplish her dreams and her goals because of this improvement in her body here.
And before we wrap up, you are doing a special just for our viewers if they want to come in and see possibly if their neck is affected from looking down or...
Right. So today what we're doing is we're doing a special. You just have to call in to the clinic at Advanced Chiropractic. Say you saw Marlena or Dr. Raesz. here on KWTX. And for the month of March, you can come in for 2 visits. The first visit, we do a consultation. That's where I'm going to ask you if you do have symptoms. I want to know all the symptoms. I want to know the details. Then we do an exam. The exam is thorough. We do orthopedic tests, which will tell me about your joints. We're going to do neurologic tests, which tell me if you have any kind of nerve problems or nerve damage due to these subluxations, these misalignments of the spine. Then we're going to do chiropractic tests. That's going to tell me if we can help. We're going to take x-rays. Then the second visit, this one's very important, I teach you how to read x-rays because we want you to be the doctor. We want you to be educated. So when I bring you back and I bring up your x-rays, you can see exactly what's going on so you can make the best health care decisions for you and for your family. Now, if you were to go to the hospital and get all the tests and all these x-rays done, I mean, this could cost you hundreds of dollars, maybe $1,000, maybe more than that. But what we're going to do for all of our viewers, we're doing it for just $59 in the month of March.
Well, that's a great deal. Well, thank you, Dr. Raesz, for being here today, and make sure to call Advanced Chiropractic to get your 2 consultations.
Awesome. Thank you so much, Marlena.
Well, thank you.
Yeah.
And we'll be right back.